Hi, everyone. We're so glad that you took part in our special research with the University of Southern California. I'm Todd Keats, founder and CEO of My Care Friends, and I'm passing it over to Katie.
Hi, everyone. I'm Katie Seymour. I am Vice President of Programming and Community with My Care Friends, and we're so happy to have Dr. Raj here to talk with us about sleep.
Hey everyone, spoiler alert, I'm Dr. Raj. And so anyways, I'm actually here in Southern California. USC is always going to be near and dear to my heart. I'm actually certified in sleep medicine, pulmonary, which is the lungs, some critical care. I don't wish to see you in the ICU, and internal medicine. And it's always a treat to talk about caregiving because not only do I teach it, I was in the trenches with my dad and with my son, so I know all about caregiving.
Yeah, thanks, Dr. Raj. So, as Katie mentioned, the topic is sleep. We're calling it the Ultimate Sleep Webinar. It's something that everybody that I know at least is challenged with, that topic of sleep. And then when it comes to caregivers, like all of us, all three of us here have been or are caregivers. I'm caregiver, primary caregiver to both my parents. Katie's been caregiver to her parents and her sister, Raj to his son, his father, and so forth. So we're just going to jump in and hopefully we can present information here that will help you in your caregiving role get a better night's sleep, which will help you with the rest of your life. So without further ado, Raj, so
Yes.
this topic, I know we've talked about it a lot over time, but let's focus on it for caregivers. If you had to break down the topic of sleep, what would you say are the most important aspects of why you need it and what can happen if you don't get it?
All right. So I think getting good sleep is a little easier said than done, and we all want to get good sleep. So I break it down into the two cues of good sleep. Number one is always going to be the quantity. That's the first cue right there. So it's how much sleep are you getting? So of course, someone's going to say, "Well, what's that number?" And it depends on, well, how old are you? And don't worry, Todd, I don't need to know your age, okay? But the thing is that sleep is important even as we get older. Of course, when you're a little tiny baby, we're talking like 12 to 15 hours, but as we get older, that sweet spot's still around 7 to 9 hours of sleep, with I guess eight is the magic number, but who's really getting that? And it's tough for a variety of reasons. And you can just imagine being a caregiver that hey, your loved one needs to go to the bathroom, your loved one got out of bed, your loved one needs their medications. It's hard just to get that quantity of sleep, not to mention you're stressed. And when you're lying in bed, whether it's in the same room as the person you want to be with or a different room, I don't think your mind's ready to drift off and transition into sleep. You just have that sense of anxiety, that sense of worrying. So, difficulty initiating sleep, difficulty maintaining sleep, early morning awakenings. How many caregivers experience that? Everyone. So the quantity of sleep you have is going to be reduced as we get older, and of course, as you're a caregiver. So, what is the second cue? The second cue is the quality of sleep. And what does quality mean? It means, hey, are you getting into deep sleep? And the key word is and are you getting REM sleep? REM stands for rapid eye movement. And that's where you have these vivid HD TV-like dreams. And you need these two stages of sleep to help out with cognition, memory, health, immune system, you name it. So there are many individuals that might get the right magic number, that 7 to 9 hours of sleep, but they still feel tired, fatigued during the day. Why? Is for some reason they're not going to that deep stage or REM sleep. And what can do that? Well, undiagnosed primary sleep disorders or regular disorders. Maybe you're too many trips to the bathroom. Maybe you have bad heartburn. Maybe you have obstructive sleep apnea and you're always waking up. So the key thing is to address those two. But regardless, I think that there are always some nice tips that hopefully we're going to talk about to help any caregiver, any person out there try to get a little smidge better sleep.
I've got a question for you. You brought up the
Yep.
topic of transition.
Mm.
So we know King caregivers, it can be a challenge. You're helping if you're helping with ADLs all day long, or even just at nighttime, whatever you're doing, and then you're exhausted. Your body may be exhausted, your mind's not exhausted. So you use that term transition. What are the do's and don'ts of transitioning into a good night's sleep?
So I definitely say what happens during the day definitely affects what happens at night. So during the day, if possible, prioritize waking up in the morning. Don't hit that snooze button. I'm a victim. I always hit the snooze button because you're tired, you know. Try to get out. Granted, I'm spoiled. I live in Southern California, but getting out, getting the sunshine, hitting you right away, having a routine during the day, watching what you eat during the day, don't eating late at night. Yeah, maybe it's tempting with all the stress to maybe grab that beer, that wine, you know what I mean? Those two fingers of scotch, but don't, you know, it's going to actually make things a little worse at night. That cigarette, that caffeine, try not to do it later in the day. So, what you eat, when you eat, trying to stay active during the day. So you have to stay healthy. And how does staying healthy mean for every individual? Moderate exercise. You know, when you hear these tips and someone's like, yeah, sweat till you drop. No, that's not the way to do it. You know, you got to actually do just some walking, just things that will get your heart pumping a little bit. And I just did this article about the different zones of heart rate.
Mm.
So zone 2 is where you want to be. That's my money zone, you know, where it's kind of like things you could do a little more endurance. It helps out with burning some fat. You could do it for longer periods of time. And that's not sweating your butt off. That just means taking a nice walk. So these are important things during the day to set you up for that transition at night. But what are going to be a good transition thing? All right, everyone's going to freak out a little bit, but see, this is called a cell phone. And can't even do without smiling, is that what you need to do is put it away before you go to bed, maybe just, you know, half an hour before you go to bed, but put technology away. You know, do things that are going to be not mentally anguishing, you know what I mean? And having your own routine after you take care of your loved one. All this is easier said than done, but it's these little tips that could really just help out.
No, that's great. Katie, you have something?
Yeah,
Go
I
ahead.
do have a question, and this is great. Thank you so much for that insight. Yes, the cell phone, put it away. I actually put mine on do not disturb, starting at
Yeah.
early hours to late hours in the morning. But I want to talk about physical health because I think as caregivers, it's really important to note that because we are caregiving for our loved ones who may be physically need support their own physical health. And I'm curious what your take is on if there's a link between poor sleep conditions and other conditions like high blood pressure, weakened immune response, and those kinds of things, because that really impacts us as caregivers with sleep as well.
Yeah, so of course it comes down to taking care of yourself as a caregiver. Who has high blood pressure? Everyone, you know what I mean? And the whole thing is that at nighttime, you know, our heart rate and blood pressure really should go down a smidge, you know what I mean? But if you have insomnia, if you have sleep deprivation, obstructive sleep apnea, that heart rate stays elevated, that blood pressure stays elevated. And really, nighttime is a time for the heart just to relax a little bit. So, if you do have untreated disorders or you're not sleeping, you could just imagine the heart is now working 24 hours a day. So, that's why heart failure, high blood pressure, poorly controlled type 2 diabetes, just naming those risk factors right there. Not to mention is that if you're getting poor sleep, quality or quantity, it's our mood. You know what I mean? I mean, Todd and Katie, how many times you go to work, someone got poor sleep last night, or you did, and you're a grouchy person. You know what I mean? Your threshold for like just snapping at people is low, even though I can't see Todd snapping at anyone, you know. But, you know, I'm just telling you, and if you're a caregiver, it's already frustrating. Like, especially if you have someone with dementia, how many times did you tell them something over and over and over again? I mean, you need to be on AHAM. And so Yes, it's your personality, it's your patience, it's your, and you're making decisions for people, you know what I mean? And you're not going to be on the A game to do those things.
Right.
So, and not to mention, depression and sleep is like peanut butter and jelly. And are you depressed because you're not sleeping, or is it not sleeping making you worse depression? So, yes, I think this is definitely a caregiving thing of making this an importance.
How, to follow up on your point about putting the phone down, what,
Is
what,
it freaking you out, Todd, putting your phone down?
well, I just had to think of to myself, yeah, I got to put my phone down. But I, the question then becomes, how can people prepare for sleep? You told them to put their phone down,
Right.
but I mean, I know there are meditation apps, there's different ways. What do you suggest to caregivers?
You know, I would say I love breathing, and you're asking the pulmonologist, why wouldn't I pick a breathing technique? You know what I mean? And so I like this 4-7-8. There's so many numbers to remember now. I think it's 4-7-8. So it's all about diaphragmatic breathing. I'm all about in through the nose, out through the mouth. So I think it's 4 seconds breath in. Then you got to hold it. You know what I mean? The hold's for like 7 seconds. So good luck if you have COPD. Just joking. But 7 seconds. Then you breathe out, exhale through the mouth. And I feel like that helps relax you if you combine it with, I love meditation. I love just awareness of yourself. I love doing things like, yoga type things. I think those are amazing, and of course, trying to get your mind off things. So breathing techniques really help out. I hope they relax you. I think that rules of thumb, the room should be a little bit on the darker side, the quieter side, the cooler side. Yes, yes, and more yes. You know what I mean? But one tip I'm going to say right now, and I'm really passionate about it, don't get over hacked. You know what I mean? Hacked is where these words that these young kids use. So I'm trying to copy them. So hacks are going to be like, hey, there's a Sleepy Girl mocktail. Hey, there's this and there's that. I mean, don't get over into it. You know what I mean? I think that it's nice that younger generations are trying to focus more on sleep, but it really is just the simple things. And I think if you try to overthink it, then you're going to get a secondary insomnia, which is why when you start looking at these phones and your phone tells you this is your percent of sleep and this, I don't mind these devices trying to encourage me to get more steps in the day and encourage me to get better sleep. But sometimes this can be the source of anxiety. So don't focus too much on these apps. Don't focus too much on your screen time. And those are my tips, Dodd.
I appreciate that. I want to ask a follow-up. Katie might have one also,
Yeah.
before I forget. So I'm going to ask you to put both your doctor hat on and your partner hat on. So caregivers, often they may be part of a partnership, whether it's a wife, a boyfriend, whatever it might be, girlfriend, so forth. What are your thoughts when it comes down to, okay, I'm done. I just took care of mom and I'm exhausted. I need time. And they got to get in bed with their partner. But that partner may want to chit chat or may want to do. So you have any thoughts from both your doctor and maybe your partner slash therapist that might be helpful?
Well, there was something, and I think I'm saying it correctly, called Scandinavian sleep. And the Scandinavian sleep method was actually a method where you had almost like kind of like two different parts of the bed. You know what I mean? Like one person slept in this bed or this side of the bed, two different covers, two different blankets, because everyone's different. Sometimes your bed partner is very sensitive. You know what I mean? It wants everything so quiet. And sometimes it doesn't matter. And someone's getting up a lot. So I do think it's knowing your audience, knowing your loved one, knowing your bed partner, what you want, you know what I mean? But of course, I think this is a really good point because whether it's sleep or caregiving, it's not one person, it's a team, it's a family, you know what I mean? So of course, you know what I mean, my wife is a doctor and the nicest, sweetest, coolest person in the whole world and beautiful. And so we're on the same page. And, whether it's the fact that my mom is moving in with us, I mean, it's being the most understanding wife to do that, or whether it's her seeing me kind of suffer when I was helping my dad with Alzheimer's, or us together when our boy Aiden with autism is not sleeping and we're both sleep deprived. Yeah, it's always a team. So good tip for everyone listening today is you definitely want to make other people in the household on the same page, because how can you transition to sleep if not everyone's on the same page? And I also just being honest about it. And it's okay to say that, I had a rough day. I think I just need to actually be a little bit by myself, or if you could be more quiet today, or maybe just take the TV out of the room for a few weeks. Just say what you want. I mean, sure, it may be kind of rough in the beginning, but it's really communicating is the key thing in life.
Yeah, great. That's great advice.
Yeah.
Yeah.
Yeah, great question too. Yeah, I have
Yeah,
one
that's a great question.
follow-up question that I'm sure our audience will be interested in hearing more about your thoughts around this. Over-the-counter solutions, right? Any therapies, melatonin, CBD, all the over-the-counter. I would love to know because I know that comes up. I'm a mom. That comes up a lot as well. Get your kids sleep. They take the melatonin. So what are your thoughts around there? On that?
So I think we're going to be talking about dietary supplements. You know what I mean? And that's the key
Yeah,
thing. They're not FDA approved drugs. They're over the counter. They may be FDA regulated. You know what I mean? So the
sure.
big ones I think are melatonin. You know what I mean? Melatonin is not a very potent hypnotic. You know what I mean? So it's not about cranking up the dose. And that's always the question. What is that dose? And is it
Right.
truly melatonin? Or did someone sneak in a little Benadryl in there? I don't know. You know what I mean? So it's really about the timing. For most individuals, I think 1 milligram up to 3 milligrams is the way to go. It comes in different forms, which is kind of weird and scary. Like they all look like Sour Patch gummy bears. They taste good. So not only can you get cavities, you could help out your sleep, but I would just say, why are you taking it? So, maybe the answer is just don't drink alcohol too much at night. Maybe the answer is exercising during the day. So melatonin is like any dietary supplement, a bandage. But
Right.
remember, talk to your doctor first, and it's all about the timing of the melatonin. So I usually take it around 2 hours before my desired bedtime. So it would be 8 p.m. if I want to go to bed at 10 p.m. Everyone loves magnesium. It's just whatevs. So I would just be careful. Magnesium comes in many different forms, and sometimes we take magnesium to go poo. So remember, you may be getting a lot of trips to the bathroom if you're taking too much magnesium. And also, if you have kidney issues, too much magnesium can lead to arrhythmias in the heart. I'm just being scary. But if you just take a little bit of it, no big deal. Remember, rules of thumb that taking something beyond your diet, the recommended dietary amount per day, doesn't do anything. If you want magnesium, dude, pick up some green leafy vegetables, you know what I'm saying? But sure, it's a big thing. Magnesium causes relaxation. It helps out. A lot of people like to take it. You know what I mean? There are things like valerian root. There are things like tryptophan, things like chamomile, things like lavender. You know what I mean? You kind of mumbled CBD. Don't mumble it. Everyone loves CBD, Like, but the question becomes with all those, what evidence do we have behind it? And
Right.
people always ask me, what's your take, Dr. Raj? Well, of course, comparing it to pop and Ambien, I'm sure it's better that you're taking these little supplements here and there, but always ask the question, why are you taking it? You know what I mean? And the last thing that's everyone always seems to ask me about is, should I tape my mouth before going to bed? Because there's some hack on, TikTok that says you should tape your mouth for better sleep. That's a big no-no. Taping your mouth does not give you better sleep. And you better make sure you don't have obstructive sleep apnea before you tape your mouth shut. So I think all these things are great. And if you do want to do any of these things, just talk to your primary care, talk to your sleep guy or girl or whatever it is, and always ask yourself the question, why?
That's
Cool.
great. All great advice. And this time has flown by. So before we say goodbye to everybody, anything really important topic that maybe we need to at least touch on before we say sayonara?
I just want to say this, that I want to say, good luck and just really give kudos to all the people doing caregiving. Like I said, my son has autism. I can't tell you how much patience it taught me. And there are more days where you're frustrated and more days where you're just like, oh, where's that squeezy device? You know what I mean? Than happy. But it really takes a special person to do it. People with Alzheimer's whose families are taking care of him. I'll be the first to say Alzheimer's, dementia is always worse on the caregiver than it is for the patient. I don't wish it on any patient, but we don't get enough credit for what we do as people, not even as a doctor, as people taking care of it. So I hope this video is helpful and informative to you.
Great. Well, thanks so much, Dr. Raj. We appreciate your time, your insight as always. And Katie, thank you so much as well. And I'm Todd Keats, and we're out.